Bruce.
Bob, should I go ahead? And thank you, Derek.
My pleasure.
Sure, go ahead, Bruce, and welcome from all of us.
Thank you. I'm sharing my screen. Can you all see this okay? Good. Thank you, Emily, for nodding. I will assume you're like everybody else in the group. It's a real pleasure. I want to send my greetings from San Diego, where it's probably a bit warmer than it is where you are right now. I live on the coast in San Diego. Actually, my origin story with climate begins on the coastline in San Diego, but that story has moved forward. We're going to talk about our research that ended up in a JAMA publication a year and a half ago about bad birth outcomes in the US, but importantly, also we're going to talk about what we can do about the evidence that we've uncovered. And as the royal we has the meaning that we've all become familiar with, I'm talking about you and I. What we can do about it, and also, believe it or not, some good news on the climate front. So without any further delay, I'll just throw up my mandatory disclosure slide. One thing that I guess I should admit to is I'm not a researcher. I was the lead author of this study in JAMA. I don't have a long CV. I have no academic training. I was a clinician. I delivered babies in San Diego and Los Angeles for nearly 30 years before I became a full-time activist in 2013. But again, I'm not talking to you from the halls of academia. I was in the trenches with the rest of you for the clinical part of my career, and I've been a full-time activist since 2013. I still feel like I'm acting as a physician, but I don't take care of patients. Earth is the patient that I've decided to help take on. We're all familiar with this image, and this takes us back to the beginning of the discussion about this problem, to what we romantically call global warming back in the early 2000s. And you remember this guy, we saw these pictures a lot. It's a compelling image, and I happen to love polar bears and many other animal species. The problem with representing this problem of what we call global warming this way was that it tended to make people think that it was happening somewhere far away from us and at a time in the distant future. So it was not an effective messaging tool, but it introduced the concept, at least back in the early 2000s. That's largely been replaced by this fellow, the struggling weather person. He could be in Texas or Florida, somewhere where they have one in 500-year floods every 6 months to a year nowadays. And this is the sort of species that I think we worry about when we talk about what had morphed from global warming to climate change around 2010 and going forward. But this also had an unfortunate side effect of making us think that this problem was really about extreme weather, about these events that occur on occasion increasingly around the world and within the US. But the problem is really not about extreme weather, although certainly when those events happen, the superstorms and flooding events and massive fires, it really is all about that. But most of the time we're dealing with something else, and that is the health impacts of the daily effects of what we now call a climate crisis. And those health effects have been called out by organizations like the World Health Organization, American Public Health Association, many other old and new nonprofits and physicians groups and medical groups talk about the link between the climate crisis and human health. And it spans the specialties, again, everything from the American Heart Association, the American Lung Association, to the Children's Environmental Health Network. And some of the newer organizations you might have heard about are the Medical Society Consortium for Climate and Health, which through its member societies includes over half of US physicians. Climate for Health, which is a program from ecoAmerica that I'm connected to. And Physicians for Social Responsibility, which is still around and has a dual footing, both anti-nuclear weapons and anti-climate change. So all of these organizations make a big push to speak about the connections between the climate crisis and human health. And it has become a dominant way of talking about this problem. And COP26 that was taking place in Glasgow late last year, and the most recent IPCC report both make full use of the connection between climate and health to talk about this problem. Now, my own connection to research and to looking into this in terms of the data that was showing up began with the release of a policy statement from the American Academy of Pediatrics back in late 2015. Sarah Adut and Susan Pacheco were the primary authors of this paper, and it listed really for the first time all the different ways that climate change was going to affect the world's children. And this report included a rather startling statement, which was that over 85% of the disease burden of climate change would fall on children under the age of 5. And of course, not only are they not the slightest bit responsible for this problem, but they're also least able to tolerate it physiologically. So this woke a lot of us up. And I and others began wondering whether or not the impact occurred even prior to childhood, whether or not there was any sort of fingerprint of climate change on pregnancy and births. And I managed to pull together a group of actual academics that could help me answer this question. I felt I'd already been involved with this problem since 2007, but I just felt like as an OBGYN, this was a question that should be answered. There was a lot of evidence out in the literature, and we began going through it. I worked with Dr. Susan Pacheco, who is one of the co-authors on the pediatrics paper, in addition to Rupa Basu, who's a division lead at California's EPA, and a fellow by the name of Nate DiNicola, who's an OBGYN who's pretty high up in the ACOG structure and was already identified as someone who was very interested in environmental issues. And Nate and I did the majority of the work looking into the evidence that we had found. And just for background, as you see there on your screen, ACOG had a position statement about the connection between climate change and women's health, but it was rather brief and didn't really address pregnancy impacts. So we ended up finding nearly 1,900 references that had some connection between climate change and birth outcomes. They were from studies all over the world, various types and approaches to looking at these questions. And we ended up going through all of them and looking to see if there were any that were essentially looking at the same topics. And basically what we found were 68 studies that passed all of our criteria in terms of quality and types of studies and things like that, that looked at the very, very common, almost daily exposures of elevated temperature and air pollution tied to climate change. And I'll say a little bit more about what those air pollutants are in a moment. And the serious, but also rather common outcomes of preterm birth, low birth weight, and stillbirth. Again, 68 studies. And after close to 3 years of analyzing the data and not really knowing if we would find a clear signal, and again, we isolated our analysis to US populations because we didn't want to give people the opportunity to say that this is happening somewhere else and it's not happening around us. But those 68 studies, 57 of the 68 found a statistically significant association between these very common inputs, the elevated temperatures and air pollutants tied to climate, and those bad birth outcomes. And those of you who are not obstetricians are probably aware that most preemies and low birth weight babies survive these days. Of course, stillbirth is one of the worst things that could ever happen to a woman and her family. But preemies and low birth weight babies, although they normally survive, it's still a very difficult thing because those babies have a higher risk of neonatal death, as well as serious respiratory and neurologic problems in the first 5 years of life. And we're learning that preemies and low birth weight kids, once they grow into adults, have a higher risk of very serious major health outcomes like cancer and heart disease. So it's a really rotten way to start a life. And that's, again, the preponderance of the evidence. The studies that we found were large studies. The mean number of births per study was over 550,000, a total of 32 million births in all in the US. And we submitted our findings to JAMA. It was the only journal we submitted to. It was kind of a long shot, but happily they decided to publish our findings almost immediately. And actually the timing that they chose turned out to be rather fortuitous in terms of the publicity that we received and the opportunities that we've gotten to talk about our findings, but we're going to get to that. Speaking of air pollution, I grew up in Southern California, and days like this, where the buildings were obscured that were just a few miles away, were so rare that we basically would just call them Tuesday. These were days when it would hurt if you were a little kid, if you were out running around, as we are wont to do in childhood. Your lungs would hurt after an hour or two of being outdoors. And the air quality has in fact improved in Southern California, although there are still plenty of days that are like this. And I think it's likely that we will see even more. The two types of air pollution that we're talking about that are particularly tied to climate change are, first of all, ground level ozone. And ozone increases with exposure to both heat and sunlight. And fine particulates, or PM 2.5, not only associated with the impacts of climate change, but also directly from the burning of fossil fuels. So those are two pollutants that we took a look at, where a lot of the evidence in the literature was pointing. And just to talk a little bit about our findings, in preterm birth and air pollution, 19 out of 24 studies found a significant association, with a median increased risk of 11.5%. Low birth weight, 25 out of 29 studies, with a median increased risk of 10.8%, and stillbirth 4 out of 5, with a median increased risk of 14.5. Now, you can't take those numbers to heart. This is not a meta-analysis. There was way too much heterogeneity in the way the studies were designed and carried out, in the endpoints they looked at and the time periods of pregnancy that they studied. However, we actually feel that that's one of the strengths of our review, was the fact that almost despite whatever type of research methodology was used, basically almost all the studies came to the same conclusion, and that is that there's a statistically significant and strong association between these bad birth outcomes and air pollution. It also helps to reinforce the argument, the fact that other articles in the literature pointed towards mechanisms that that make the connection, for instance, between air pollution and preterm birth likely. We know that one of the things about fine particulates is that it's a heterogeneous group of air pollutants, but they're defined because of their size. 2.5 microns or smaller. So that's what they all have in common. And what that does is it allows them very good access to the bloodstream. They get into the lungs, very deep into the lungs, and get into the maternal bloodstream. And we do see evidence in other literature of increased systemic inflammation in response to these air pollutants, to oxidative stress, endothelial dysfunction, changes in blood pressure, all in response to air pollution, and forming a nice basis to imagine how air pollution and preterm birth would be connected. There's another study done by Casey's group in California that looked at the rates of preterm birth in women carrying pregnancies in and around 8 different fossil fuel powered electricity generating plants in California, looking at the rates before and after the closing of those plants. And what they found, adjusting for confounders, was that after 10 years, the rate of preterm birth, again in women carrying pregnancies near where these plants used to be operating, after 10 years of them being closed, the rate of preterm birth had dropped over 25%. And as anybody in OBGYN knows, that's a major decrease in preterm birth rates. And it helps to bolster the argument that this is a cause and effect, because if you take away the air pollution, at least a significant part of the air pollution that these mothers were breathing, we do see a reduction in the risk of this outcome. The other thing that this provides, which I think is very hopeful, is that if you do close or eliminate sources of air pollution, we see demonstrable significant reductions in risk in a pretty short period of time. And to me, that's very heartening. A lot of what we need to do to face the climate crisis is going to take some time before we actually see a difference in temperature. But it's nice to know that the health benefits in many cases that have been looked at, and this one in particular, accrue pretty rapidly. Excuse me. Pivoting over to heat, this is a graphic. You're probably familiar with the concept of urban heat island. The temperatures are substantially warmer, even just a few blocks away in areas of downtowns, typically where there's poor air ventilation and not a lot of green space. This has very real meaning for people that live in these areas or work in these areas, especially if they don't have access to air conditioning. So speaking about our findings regarding heat, the majority of our papers that we talked about, probably 75% of them were about air pollutants, but those that were on heat, 4 out of 5 on preterm birth, all 3 on low birth weight, and both studies on stillbirth, all found very strong association between heat and these bad birth outcomes. So again, very high percentage. And there is also, and I'll leave you to look at this in more detail afterwards if you want to review the slides, but there are plenty of explanations present in the literature as to how heat might trigger a preterm birth. One of the more common things that we would see on labor and delivery, and I understand still ongoing, is that when women get dehydrated, it is one of the primary causes for both Braxton Hicks or false labor and also preterm labor. And one of the first things we do when women walk into labor and delivery contracting is we put an IV in them and start to tank them up. And a lot of times that and a little bit of bed rest will quiet things down. So we do know that there's a connection between hydration status, which can be certainly tied to heat, and preterm labor. Also, small for gestational age or growth restriction can be affected by heat. In those methods that are mechanisms that are listed there, as well as the phenomenon of stillbirth. Substantial reduction in amniotic fluid or damage to the placenta or abruption certainly can lead to stillbirth. So these are all, again, mechanisms that help us to begin to look at the data that we're accumulating as that it is more than just a statistical association, that it is in all likelihood a cause and effect type of phenomenon. Now, another aspect of our data that we didn't go looking for was evidence of racial disparity in findings. And in particular, the studies looking at air pollution in both preterm birth and low birth weight, more than half of the studies found worse outcomes for minority moms, with Black moms being mentioned more than twice as often as Latinas, who were in the next highest risk group. And we felt that this was kind of not an altogether surprising statistic. Probably many of you know that for years now, we've recognized that there's a substantially higher mortality risk for Black moms who are pregnant than white moms in this country. So the fact that their births are also at higher risk sort of fits with that. And again, this was a pretty striking finding in more than half of the studies with air pollution and those types of birth outcomes. And it turns out that JAMA happened to decide to publish our study on June 18th, and which was right in the heart of the Black Lives Matter movement in this country, just a couple of weeks after George Floyd had been brutally murdered by the police in broad daylight on a city street in this country. And so the fact that we found higher risk for minority moms and Black moms in particular really resonated with the public, as I think did our findings. And I think maybe one of the reasons our study has gotten the number of views that it has is it really wasn't appreciated before our work came out that there was a real association, a real connection between the common impacts of climate change and bad birth outcomes. So we actually got a lot of publicity, way more than we expected, in papers and various media outlets around the country and in many other countries around the world. And Dr. Gynecology and I have been busy speaking about this ever since our study has come out. Now, I'm briefly going to go over 2 studies that have come out since our paper. There have been many. These are not more important than the others, but just to let you know, we're starting to fill in some of the blanks. This study about heat and stillbirth in Florida was interesting, worth pointing out, because not only did they notice an association, but they also helped to clarify that it was during the hot months in Florida, not all year. It was kind of news to me. I didn't know there was a time in Florida when it wasn't considered hot, but apparently there are hot months and not hot months there. But they also found evidence of worse outcomes for people on the lower end of the socioeconomic scale and for Black women as well. So again, it helps to bring the picture into more focus. This study that came out of Massachusetts, I believe it was in October of 2020, was interesting not only because they found a connection between fine particulates and preterm birth, but they also looked at that in the context of temperature and found that in particular, in combination with high temperatures, the results were even worse. And it's important for us to understand because air pollution and heat don't occur separately, they often occur together. And so it's important for us to know how they all fit. It's looking like from this study and at least one other that I'm aware of, and there are probably more, that it's not only additive, but it might even be synergistic to the point where it's a multiplier when you have heat and heat and air pollution occurring simultaneously. Okay, so now we're pivoting over to what do we do about this information? Certainly we have more research that needs to be done, but I and many others believe that the evidence is strong enough, both in terms of the data that we have and the mechanisms that have been postulated, that we can start to use this information clinically. So what do we do? Again, you can look at this slide and digest this a bit more when you have some time to do it. But I think we need to start thinking about patients and their exposures. I live in a nice little beach town in California where the average income is pretty high. And if you ask a kid in my neighborhood where tomatoes come from, he just laughs and says Whole Foods. And that's true, but it sort of misses the point that the food that we eat has a backstory. And, did those tomatoes get pesticides and how far did they have to travel before they got to the market and all that? It's kind of important to know. I think an analogy to that is how we all think about patients and the fact that they don't all come from the waiting room, that patients all have a backstory. They come from the neighborhood where they live and the place where they work and the way they get from one place to the other. Do they have air conditioning when it gets really hot out? Can they afford to use their air conditioning? What's their indoor air quality like? Is there any plan being made for women who are pregnant when we know there's a heat wave coming? So I think it's important if you live in an urban heat island to pay particular attention to this, or if your housing quality, so-called, is very poor, then you're running your gas-powered heaters a lot more often in your house and creating a lot of indoor air pollution. So there's a lot that can be said about this. And I do want to at least let you know that I'm not telling you need to add this on to the counseling you already do, but it would be helpful to be thinking about it. In addition, to give you some more information about environmental or climate issues in particular, but environmental exposures globally, ACOG has refreshed their committee opinion about prenatal exposure and toxic agents, toxic environmental agents. This committee opinion was released just last summer, and Dr. Gynecology, the mate that I work with, is one of the primary authors of this. But you can find this online, and it's a very handy guide to all sorts of toxic environmental exposures that pregnant moms should avoid. So this is a new nice reference for everybody. And I just want to mention Dr. Cheryl Holder's excellent TED Talk. You can look this up if you want to on Google. What she has done and her partners at Florida International University is they've sort of automated the process of how to identify patients who are at highest risk of environmental exposures in their practice and do it without impacting on physicians' time. And what they do basically is use questionnaires with patients out in the waiting room to help identify the patients that live in urban heat islands or live in areas where there's heavy industry or other exposures, to identify patients who don't have access to air conditioning. And then the patients that are identified on these questionnaires are then able to meet with a staff person, not a physician, but it's somebody who has been trained in how to counsel patients to reduce their exposures, letting patients know where there are cooling centers, where there's a library or a mall or something like that near them, and to pay attention to when heat waves are coming up, to plan to spend more time in those places if in fact they don't have air conditioning. And if they do and they can't afford to use it, They may be able to qualify for low income, lower utility rates, which might make it easier for them to afford, if they're aware, to run their air conditioning more often. There might even be funding for them to change out their old types of heaters into something that produces less indoor air pollution. So this process can be integrated into how a practice functions. And if you think about it, it's not really necessarily just something that'll take more resources from all of you. It's something that might help your patients end up in the emergency room in the hospital less often. Pregnant moms and the other vulnerable groups, children and the elderly and the poor and people with chronic illness, whoever it is you take care of, if they get less sick, that's good for everybody. So you can be thinking about it. So what if we did a really good job counseling, and what if the healthcare sector, through organizations like Healthcare Without Harm and Practice Green Health, completely eliminated its carbon footprint? We would still have a climate crisis facing us. It's true that the health sector of the economy is a major contributor to greenhouse gases, but it's by no means enough, even if we zeroed it out. This slide makes the point that if you thought COVID was difficult, and clearly it was a huge problem and a tragedy for so many families, it's nothing compared to what's coming at us. And I think there are a couple of approaches we can take to facing this reality. One of them, which I don't know if you saw the movie Don't Look Up. This is one way to do it. Just kind of throw your hands up and decide that there's just nothing we can do about it and we're all going to die. Well, that's no fun. We can start thinking about the good news that there is out there. So now we're going to pivot to what we can all do outside of the office, outside of the hospital. And I think part of it is just realizing that truly all is not lost. There are some things that are going on that are important. This is a survey that was taken at Davos last fall, when all of the leaders of the world economies that fight over getting a chance to go to this incredibly important meeting were surveyed about what they thought the most severe risks to the world and the global economy were in the coming 10 years. And if you notice, the top three are basically all climate change. And this is according to the leaders of the world economy. They get it. And actually, all 10 of these relate either directly or indirectly to climate. So the world's economic leaders have woken up to this problem, and that's incredibly important. It doesn't necessarily make headlines, but this is how they filled out that survey. Another thing is, a lot of us feel somewhat alone or isolated when we worry about this problem, and we think other people aren't thinking about it. Well, from some recent polling from ecoAmerica, the problem is a lot more concerning to a lot more of us than most of us appreciate. If you just look at the bars on the far left, 45% of people surveyed are very concerned about climate change. But when you ask people how concerned they think others are around them, literally less than a third of that number, people think only about 14% are very concerned, when actually the number is 45. And altogether, 75% of people are either very concerned or somewhat concerned. So you've got a 3 out of 4 chance when you talk to somebody that they're thinking about this and they're worried about it. And I think it's important for us to realize that we are not alone in our concerns. That, to me, is a piece of good news. It's a real change that's happened in the last few years. We are making progress. I don't have time to go through all of these things, but COP26 came up with a global methane pledge and a declaration on forests and land. Utility energy is switching to renewables faster than anybody thought. We're going to talk about that in a moment. Global electric vehicle sales have really started to accelerate. Poor choice of words, or maybe a good pun. I read the other day, I drive a Model Y Tesla. I was shocked to find that it looks like Elon's going to be right when he says it's going to be a huge seller. It was the #2 selling car in California last year. That's of all vehicles. The #1 was, I think, the Toyota Corolla or the Camry. The #2 was the Model Y Tesla. So things are changing rapidly. And this slide illustrates that even more. The black arrow that's going up on a nearly vertical pace is the uptake of solar in the world. And all those other colored lines coming off of it are actually predictions that were made by different authoritative bodies over the course of time from prior to 2006 and clear up to 2018 of what they thought the uptake of solar would be in the world. And that black arrow actually shows that it's gone way faster. Historic projections of climate action significantly underestimate reality. There's a saying that Al Gore likes to use, which I think is fitting for here. It's from a economist in the 1930s who said that change always seems to take a lot longer than you think it will. But then once it happens a lot faster than you think it could. And I think that's what we're seeing with the uptake of renewable energy. There's just everything in the world pulling it forward. The old so-called legacy energy companies are rapidly losing influence. Their shareholders are demanding that they transition to clean energy. Economics favor this. So there's so many things pushing at this, not the least of which is that we need to do it to save our own hide. So things are moving in the right direction and moving much faster than we expected. In terms of what else is being done, Nate and I got invited to a maternal health and environmental justice roundtable with the U.S. House of Representatives back in late 2020. And we had a number of members of Congress there. And one of the things that was great about it wasn't just a chance to sit around with some people in Congress and talk about how bad things were looking. It was actually a very practical conversation about what could be done with this information at the federal level. And in fact, things are being done. HR 957 is currently before the House. Its primary author is Lauren Underwood, who's an RN in Chicago and second-term member of Congress. And she has a number of co-signers. You can see all those names there. There are probably more now. It is moving through committee. And it is called the Protecting Moms and Babies Against Climate Change Act. And it's a real, I think, demonstration of the value and the power of federal government to address a problem like this. Because not only is it about providing money to help train healthcare providers to be more able to understand what risks there are for their patients regarding climate, but also direct help to patients to help pay for air conditioning, appliances like switching out from a gas stove to a induction cooktop like I've got at home, which is awesome. Weatherization support, providing more help and organization around extreme weather events, improving infrastructure in urban heat islands to help lower the temperature, and obvious things like data sharing and improving monitoring systems. A lot of times the data that we see in studies that have been done so far are there not because necessarily the problem is worse in those areas, but just because that's where the good monitors are. So we need more monitoring systems. And of course, we need more research. But this is all on the table with HR 957. But coming back to you all and me and what we all can do, this is really unlike the work that we have done in medicine, where you first have to do well in college, then you have to get through medical school, then you do residency, and then you are released onto an unsuspecting public to help take care of them. But presumably you've been well trained by that time. You don't need special training to have an impact on climate where you live. And I'm talking about not just within your hospital and within your medical group, but I'm talking about in your community. And I just completed my 15th year of local advocacy work. And I just have to tell you that, again, you don't need any special training to get involved, and you will be welcome as soon as you show up. The article on the left is a op-ed in the San Francisco Chronicle, which got a lot of eyes. And it's written by doctors Ashley McClure and Amanda Milstein, and they are two young physicians in the Bay Area. They have never written an op-ed prior to this. They didn't have any special training. They told me this at lunch a couple of months after this article came out. They also founded something called Climate Health Now, which is a very active local advocacy organization with health professionals in the Bay Area. And again, first time they wrote an op-ed, and it got placed in part, largely, I believe, because they are physicians and they wrote a good op-ed. The other picture is a press conference that I happened to be invited to, and a number of us spoke at, but it was organized by the woman in the background there in the red dress, Nicole Capretz, who's head of the Climate Action Campaign in San Diego, which is a very influential nonprofit in the climate space. who got together, labor people and union people and other nonprofits like 350.org and some of us health professionals to talk at this press conference. Again, none of us have any training in doing this. You just find that you can, it's not watch one, do one, teach one. It's do one, do one, do one, and then probably tell somebody else about it. This is along the lines of advocacy as well in terms of training for people who know something about the climate and health connection, but want to learn more and want to specifically learn about how to write an op-ed or what to say to a city council. If you don't want to just learn by doing, you can sign up for courses online. The Climate Reality Project, which is Al Gore's organization, puts on 3 trainings a year and has a lot of information and a lot of good connections made for people that attend. It's a 3-day training. I've been to 5 of them. They are incredibly inspiring and motivating and moving. Al Gore is an incredible speaker and leader. ecoAmerica has a health ambassadors program, which is a half-day program you can do online or do in a group or individually. And the Medical Society Consortium has a number of resources that are tailored to advocacy. One of the things we've done in San Diego is we have organized a group of physicians and healthcare researchers into something called the Public Health Advisory Council, and we work with the Climate Action Campaign. They actually guide us strategically to local actions, advocacy actions, to go speak at council meetings and things like that. And it's a really powerful way to use physician time in coordination with a group that's got boots on the ground that actually knows what's happening legislatively and can guide us. So these are all ways that you can think about getting involved. But moving back to the environmental justice issue, Ben Franklin was right. And I heard this quote first time during the Black Lives Matter movement, and I was amazed. It came from Ben, although in retrospect, I shouldn't have been. He was so incredibly prescient. But I believe it's true. We are not going to solve the problem of environmental justice until those of us who are unaffected are just as outraged as those who are. And so, although it was a bit odd for Nate and I to be talking as a couple of white male doctors to a group of Black Congress people, mostly women, we are exactly the kind of people that need to speak up about this because it is our problem to solve. And I strongly believe that. And coming back to the polar bear and the weather person, this is a picture from The Guardian when they published an article about our paper coming out. And I think it's way more compelling than those images to talk about climate as a health issue and specifically about vulnerable groups that we all care about. And I think maybe I'm just an OBGYN, I'm biased, but pregnant women and their kids is a group that everybody cares about. And I want to just allow a couple of minutes for Deb Walker to say something about what opportunities there are right now in and around where you are in New Hampshire. She's a member of the advisory board of the New Hampshire Healthcare Workers for Climate Action and past president of the American Public Health Association. So Deb, can you say a couple things that people can get involved with right now?
Sure, I will, or things that we're evolving. The other thing I should tell you that I'm also doing is I am still really active with APHA and a part of the environmental committee there. And we just formed a new committee to focus specifically on climate change and maternal and child health. So to really, take the messages that you're talking about. Well, I guess I push everyone. And first of all, thank you for your terrific presentation. It's wonderful to have something that's focused on maternal and child health because it isn't often. But I also challenge everyone, and you said something about this, but I also challenge my colleagues in APHA. So we know a lot about it, but I don't think we're clear. We really are clear on what we can do at the individual and family level, what we can do in clinical practice. You gave a good example, what we can do on our municipal location, what we can do to support the state, and what we can do at the federal level. What I mean by that is people have a lot of things on their website, but we really don't have a consensus view of a lot of things. And I think we can get better at doing that. So, and we're going to try to work on that through our advocacy committee of the New Hampshire group. I have to say, I now live in a very local community of 6,000 after having lived in Cambridge, Massachusetts. So it's quite a difference. But I had an op-ed in our local paper about making sure that everyone asks their candidates for local office, because our local elections are coming up in 2 weeks, about climate action. It's very interesting because I have gotten some interesting negative pushback that it isn't really an issue up here in these locations. However, a lot of people are also supportive, but I think we just have to really keep the dialogues going. Another thing I just want to say that was, that I'm kind of touching on a few things. You mentioned that, in fact, physicians don't learn a lot about this, et cetera. But I want to just say, I teach an intensive class to the Tufts medical students on MCH. And my class really has a lot of policy stuff in it. They have to write a letter to the editor and an op-ed. So I think there are ways that you can introduce in some of the courses that relate to medical students, some of these concepts. We've not really discussed that much in, what we've been doing in New Hampshire. So I think with that, I will just leave that as the challenge of, what are those explicit steps? At every level, individuals must, I think, be activists for what's happening in their local level at the state and federal level. That's a given. But when we say that, where is that list? And the most cost-effective list, because I think some people push a lot of things in the name of reducing climate change, but they're not the bigger things. An example of that I would give is even in the federal budget, we do not push the military and all the things they could do, which would be a huge thing to do. So I'll just stop there and then get other people's, reactions and things that they're doing as well. Or maybe Bob wants to say something for our organization. Bob, do you want to say something?
Oh, you said it all. You were so articulate. Thank you. And Bruce, thanks for such a great presentation. Emily, who's our program coordinator, will take questions from the chat now for Bruce.